As Super Bowl Sunday approaches, gambling activity is expected to hit record levels nationwide. According to the American Gaming Association, more than $1.7 billion is expected to be wagered on Super Bowl 60, and that's nearly 27% higher year over year. So think of that increase. Dr. James McCowan, a clinical psychologist at the Mass General Center for Addiction Medicine, joins us now. Dr. McCowan, great to see you. So let's get into this because times are changing, right? So mobile betting platforms, I mean, they're as easy as clicking on to something on your phone. Access 24/7. You can get on there anytime, placing a bet any time of day or night. So is that accessibility having any sort of impact on gambling addiction risks?
Thanks for having me here to talk about this really important topic. Absolutely. So accessibility is a big factor here. Mobile apps on your phone, just like you said, 24/7, low stakes betting, low numbers, even apps giving you money to start betting. So absolutely, that's causing big increases in risk. We know that people that use online mobile apps have a big increase in problem gaming. About 20% of people who use online mobile apps have problematic gambling compared to kind of the general population of about 1 to 2%. So big issue.
Interesting too, because it's difficult to track, right? So if you're doing this on the privacy of your phone, you're not in a casino per se, where somebody might think that there's a gambling addiction risk, but this is not, this is different. So what are the warning signs to be mindful of, especially the Super Bowl or high stake events where people are likely betting more than ever?
Yeah, a really important topic to cover is, warning signs. So generally, most gambling for most people is not an issue, right? You might make a bet here and there or buy a lottery ticket. Most people, it's fine. But there's a segment of the population where it becomes an issue. So warning signs include starting to place higher and higher bets, maybe lying, concealing the behavior, is another big problem. Spending money you don't really have. So using your red check or that electricity bill money that you saved up is now, placed on a bet that you really can't afford to do. Spending a lot of time gambling just generally, it's interfering maybe with work or even your homework or school can be a problem, warning sign also. So those are some of the key pieces I would say to be looking out for.
And doctor, somewhat in line with the accessibility that we just talked about too, but it's almost the sponsorship too. It's out there. People are hearing about that. You can do this. The NFL, other sports leagues, also announcing partnerships with sports books. So everybody's hearing about this. So coverage of big games like the Super Bowl coming up, it will include segments about betting. So what is the treatment and research? How is it trying to keep up with this gambling accessibility? Because it is basically embedded in sports culture and everything that you might see if you're already on your phone anyway.
Yeah, you raised such a great point. The more something is repeatedly shown to you, especially when it's advertised through these large national organizations and even, former players may be part of an advertising package. And so it's very enticing and they're fun and they're enticing, the games and lights and everything, and they really get your attention, that dopamine rush. So there are options for care. I wish it was more talked about or made available, but you can certainly get cognitive behavioral therapy to help. There's medications that can be helpful if you're really struggling with a gambling disorder that are effective. There's online support groups like Gamblers Anonymous is another. And then there's National Gambling Problem Helpline that's available that you can talk to for free. And there's some surveys you can complete to see are you at risk for a gambling problem, sort of a self-assessment that can be a good place to start as well.
Great advice. Fascinating conversation. Dr. McCowan, great to see you. Thank you for your time today.
You too. Thank you so much. Have a good rest of your evening.